My name is Dr. Natasha Welch, and I am the owner and founder of the Abraza brand. I am a nurse practitioner by profession. And I started Abraza Skin Studio Medical Spa 3 years ago. And we have a location now in the Buckhead neighborhood of Atlanta. And we have another location in Silver Spring, Maryland, downtown Silver Spring, just outside of the Washington, D.C. line on Georgia Avenue. 2 years ago, I started AbrazaSkinCare, which is a medical grade skincare line. And from there, of course, it fell on me from being a professor. I was teaching master's level nurse practitioner to start teaching medical aesthetics training. So here we are. If you follow me, if you follow me, you're aware that I did a lot of lives that I shared on YouTube, and this one will be shared there as well. I wanted to make sure I gave tips to aspiring providers like myself. A lot of times people don't want to tell anyone anything. So I give a little bit of gems here, there to kind of help you along your journey. And of course, there's no charge here. That's why these are free webinars. You don't pay for them, okay? Just some great tips to get you going. So today's talk is skincare is the foundation of aesthetics. Why did I come up with this topic? Well, for one, I get a lot of people who may address me and they want to teach maybe derma fillers or injectables. And I think it's okay that you have your mindset on what you want to do in aesthetics, or they may say, I want to do microneedling, or I want to, learn how to do laser. But if you don't know skincare itself, you're missing a large part of this business, okay? Now, at my locations, we do, you can go online to Abraza Skin Studio and see all the different procedures that we offer. However, my number one seller is skincare, because I also believe that it's important what the client is doing when they're not with you. It makes no sense that a client comes to me. Now, this is a matter of opinion, right? It makes no sense if a client comes to you and they get derma filler and they're leaving with bad skin. No one's going to compliment them on their skin because the skin doesn't look good. I don't find too many people come up to me and say, Dr. Natasha, I love your lip filler. I have a little bit. I never really had the voluptuous, beautiful African lips, I tell people. But no one ever comes up to me and says that. But they'll come up to me all the time and say, wow, your skin is pretty. You don't have on makeup. And I tell them, magnetic lashes, brow, lips, go, okay? So do not underestimate the power of good skincare. So the problem is good skincare. And how do you know about good skincare? You need to go educate yourself on what's good skincare. What should be in a basic skin routine at home? You should know what brands are out here that can deliver that to your clients. Successfully deliver it, because your client's going to love you if you're giving them something good that works. They're not going to love and trust you if you're giving them something that doesn't work. And today now we're having the pop-up of a lot of new independent brands because they've realized that, hey, listen, we got to deliver not just effective skincare, but we also got to deliver safe skincare. It's safe to say that a lot of ingredients today are not safe and has a carcinogenic risk. I live in Atlanta, where African-American women are 4 times likely to develop breast cancer. And that is not because of genetics. A lot of that has to do with products they're putting on their bodies or in their hair or on their face. Okay. So it's important for me, I decided to deliver an alternative that is way more safer, but also getting effective results. Okay. I had recently spoke with a provider who told me, I don't tell my clients to buy toner. If your provider is telling you that toning is a step you should skip, you're not good with a good skincare provider. I'm telling you right now, okay? So there is a method to this madness, and there's a reason why we have all these steps. So your client should be cleansing and toning twice a day. You have to take off all the pollutants and all the free radicals that will age the skin. The skin is the largest organ. Within 10 minutes, anything you put on your skin is within your body circulation, meaning it's going to pass your liver, it's going to pass your lungs, your heart, your blood vessels. So you have to ensure that that cleanser and that toner and subsequent products are pretty clean in terms of no toxic ingredients such as parabens. If you look at the back of your cleansers and you're seeing something that says methylparaben or anything that ends with the word paraben, run. Get away from fragrances. It's another way to hide dangerous ingredients. The FDA says if I put fragrance in my product, I don't have to disclose what's really in my fragrance. And that's how some of the bad stuff get into your products. So very important to understand that piece. I get a lot of people, I'm telling you, they don't get it. And I'm just like, and then educate the client. One of the biggest reasons why I find that we have a great return in clients coming back is the education that we gave them that they didn't get anywhere else. You know, so if you just want to do that procedure and kick them out the door, most likely they might not come back. Because if they hear from their friends that, hey, I went over here and they took the time to explain this to me, they're like, well, that's where I should be because over here, they didn't do anything with me. Okay. Next is your client should be exfoliating twice a week, at least twice a week. Okay. And there's different type of exfoliators you can offer them. A scrub, and I got to be careful as a brand owner not to slander other brands, but a good facial scrub. Okay, exfoliation can also take place with other products such as a Foreo or a Clarisonic brush, different type of levels of exfoliation. But why do I love exfoliation? Because the skin is always turning over, and if you don't get that dead skin out of the way, you're going to clog pores. And now we got congested skin, which can lead to other problems, right? Like acne. You're slowing the cure for hyperpigmentation. So if we want to get the skin evened up, then it's very important that we're exfoliating. All right. So very important that you tell your clients that all skin should be protected from the sun or free radicals. All right. So I have two in my arsenal. In my arsenal, I love vitamin C. And plus vitamin C breaks up inappropriate melanin, doesn't bleach, but it also protects the skin from the harmful effects of the UV rays and other environmental factors that can age the skin. All right. And then of course, SPF, right? And we don't do chemical anymore. All right. So there's something you could go Google. What's the difference between chemical SPF? I'll leave that to you. I'll leave you with that little hint. All right. So now we're protecting the skin. I love serums. Why? What is a serum? A serum is considered serum because it's a low molecular weight. So it's very light in consistency, meaning it's not full of all the fluff and fillers. It only has a high concentration of the ingredients that are effective. And that's why serums are expensive and come in smaller quantity bottles. You only need a little bit, less is more. But it goes in deep into the dermis, right? Because we have small molecules that can go deep versus big, heavy things that just sit on the surface. And it's not doing anything but treating dead skin on the surface. The magic is happening in the dermis. So I love to recommend a nice serum with vitamin C. Okay. Then at night, some type of moisturizer, of course, or it depends. If we're trying to repair hyperpigmentation, it's a great time to add different products into the game, whether it's a retinol, whether it's another serum that does, like for me, one of the biggest things our niche clients come to us for is to help with hyperpigmentation and anti-aging with a more natural approach. Yeah, there's actually space for a woman like me, I tell people. So a lot of our clients aren't big on fillers and Botox, even though some do get it, but they're very big on what can I do before I get to that stage. Okay. And so we have different type of product that they can put on at night that help induce collagen. So it brings up collagen, as well as, again, protecting the skin from free radicals in their environment. and just start the repair process of getting the pores shrunken, giving the skin a more glow, hydrating the skin, no smile lines, using products that have ingredients that actually work. Yeah, see, tell people I smile. I like to show people that. I'm 48 years old this year. There's no smile, there's no Botox on the sides of my eyes here. There's Botox on my forehead. That's it. So I'm very transparent on what I do. And I love telling my clients that. And I tell them, listen, I get stuff. See, I had a breakout here. It's fading already. So I'm human. I'm real. I'm not coming to you beat with makeup with a filter on my face. You know, and I tell people, you have got to get your skin right. If you want to come into this industry, then you have to walk the walk. I meet a lot of people who want to come in the industry. I want to take a course. What are you doing with your skin? And I probably turn off a lot of people too. And I'm okay with that. Because I want to make sure I push out some good, successful providers out here and that get it. Okay. So it's very important. Skincare. I'm trying to think what else I can offer you in terms of that, but educating the client on how to remove the makeup. Skincare is the foundation. And that's why it's our #1 seller in our locations. And now we have Abraza ambassador locations. So we now have a handful, we have about 5 medical spas that sell our product line. So that's pretty exciting for me. It's a good time. And I'm very leery on who sells our products because I know where this is going. And it's not about everybody's money isn't good money, I always tell people. So I have to be very deliberate on how we push our brand out. And so I stay close with these owners in terms of giving them tips and how to get facials going on. Don't use that product with this. And, you know, we're very open and transparent. It's not in my goal to own a whole bunch of spas, I tell people, you know, not at my age. So at my age, my big piece is the give back. And now we're in this whole environment now of helping other businesses and being more community with one another. It's like, it speaks my ball game. Any questions I can answer? I tell people it's free. I do about 15 minutes, then I got to punch out. So any questions that I can answer with that? If you got to this webinar by way of any email groups I'm in, you can also take a look out. We have a lot of things coming up in terms of skincare, because if you're opening up a business, you better have skincare. You can't open without skincare, okay? Our skincare products work. That's a fact. You can go to the website, www.AbrazaSkinCare.com. And no, I don't know the people who put the reviews up. I don't, okay? But the reviews speak a lot for themselves. We are a small brand that's pushing that and want to get bigger. We do have a program right now for nurses and nurse practitioners or estheticians that own their own practices where you could sell products. And now we have different levels. We will be introducing that. So if you're on our email list, we'll be sure to share this information with you. You can start selling AbrazaSkinCare for as low as $99. And that's with a dropship website. So we have different levels. We have levels where you can sell the skincare and get classes with it. So there's so many different levels that will, thank you so much, Lucia. There's so many different levels to get you with selling the products. So that will come out in an email. We revamped it. We did our first, what I like to call them the, what do I call them? The cohort group. So in March, we launched the ambassador program, and thank God, blessings are good. When we had to close our locations for COVID, we signed on 13 ambassadors. And I've been working, I feel like they're like my best friends now. We've been working very close. Now we're opening for the ones who have the hands-on training component. They're coming in this Saturday, June 13th in the Atlanta location. We did virtual training with them, and now they're coming on to do hands-on, and we're teaching them the microneedling class. All right, so pretty exciting. And we have a lot of things to help support